I've been involved in the treatment of schizophrenia since 1950, when I first was retained by the Saskatchewan government to become Director of Psychiatric Research for the Department of Public Health in Saskatchewan. In 1950, if you were admitted to a mental hospital for schizophrenia, there was a life sentence. You never got out. And the hospitals were absolutely terrible. Coming through okay?
Yeah, fine. Sorry.
And so in starting our research, this was the main problem. We had in our hospitals over 5,000 chronic patients, of whom half of them were chronic schizophrenic patients, and they weren't doing very well. We had no treatment at all. They had ECT, which helped some of them, but not for very long. We had insulin coma, which was dangerous and helped a few. So about 1951 in the fall, Dr. Humphrey Osmond came from England, and he brought with him an idea that he and his friend had developed while they were there in England, and which was that it was possible that in the schizophrenic body there might be a compound that was the cause of their hallucinations. In other words, it was an idea that there might be something present with the properties of mescaline, but somehow connected to adrenaline. It was a long story which I won't go into. So then we developed the adrenochrome hypothesis. In other words, we developed the idea that there was an abnormal conversion of adrenaline to adrenochrome. And this was the beginning of our research. We felt that this might be a way of getting at this terrible problem. Now, looking back over the years, it's now 55 years since I first got involved in the treatment of schizophrenia, there has been a major difference, but the results of treatment are not any better. And that's the irony of it, that in spite of all the modern advances in psychiatry and in medicine, the results of today's treatments are really no better. The only difference is that in those days, they were all incarcerated in old, inadequate mental health hospital buildings. And now most of them are kicked out on the streets and they are homeless. Half the homeless people in Victoria are in fact chronic schizophrenic patients who have been discharged from the hospital on the modern antipsychotic medication, which is helpful, but it doesn't cure anyone. And to give you some historical perspective, in 1850 in England, there was a doctor called John Connolly who developed a treatment for what they call the insane, and they also had at that time the Quakers. You've heard of the Quakers. They had the moral treatment of the insane, what we would call today schizophrenics, and they found that if they treated these patients, the insane people, they put them into special houses that had no more than 12 people. They had no doctors, no nurses. They were treated by the members of the Quaker faith. They got half of them well. Half of them recovered in 1850. And what did they do? They gave them shelter, good food, and they treated them kindly with attention and humanity. They gave them the absolute 3 essentials of any treatment. Today, with modern medicine, the recovery rate is less than 10%. This is hard to believe, but with schizophrenic patients today who gets treated with the modern drugs, less than 10% will ever be fully gainfully employed thereafter. I think this is a terrible shame. And this is what's been happening. The treatment for schizophrenia today is not adequate, except for the treatment that we helped develop called orthomolecular treatment.